Hello, everybody. Welcome to the second part of the book launch for the book, How to Eradicate Diabetes. Warm welcome to everybody who is tuned in. We've got our authors today, myself, Sharmila Sinha. We have Dr. Shritama Banerjee, who has joined all the way from India. Hi, Shritama.
Hello.
Hi. We've got Dr. Ankuran Kakoti, who has joined.
Hello.
Hello, hi. And we have one of our readers, one of our, from the book club. She's also a devotee of Swami Sivananda, and she's, kindly agreed to join in today to give some feedback about the book and her views on how Baba has inspired her. So she's gonna be our guest today. So warm welcome, Arunima, all the way from Switzerland.
Hello.
Hi. Right. So let me first begin by sharing a very good news I wanted to share, because we launched the book on the 1st of March. And already this book, How to Eradicate Diabetes, inspired by Swami Sivananda, oldest living man in the world. It went on the top of the charts on Amazon Hot New Releases. This was the clip on the 2nd of March, and it was ranking number 5 in medicine. This week, it has ranked number 1 and number 2 under the categories of medicine and personal health, both in India and in the UK. It has ranked up to number 2 in medicine. So this is the bestsellers in personal health. At the moment, is ranked number 2 in the UK, and this is in medicine. These are the UK ratings. This is medicine. It's number 5, and in the UK, it's number 2 in personal health. So, Shritama, do you want to share what have been the ratings in India? How have the book been doing in India?
The book has been doing great, and it's ranked number 1 in medicine. It was ranked number 1 in medicine on the very second day of uploading the book on Amazon Kindle, and it has done amazingly well. Because India is the diabetes capital of India. It boasts of being the diabetes capital in a negative way, I should say. And this book is an amazing asset to our country, to India.
Thank you. So this really pleased. This is the picture of Swami Sivananda. He was born on 8th of August, 1896. So I would like to come to Arunima. You know Baba from a very long time. Tell us, what do you think about the launch of this book, and what do you think of the book title? Because it's inspired by Baba.
Yeah, so that first of all, I will like to say pranam to Baba. And actually, I had interest, or I am now in this meeting because of Baba only, and also because of you, because we know, and like this book, we know how to live disease-free life. That is very important, and we are all inspired by Baba. We want to do all like yoga or meditation, what can help us to live our life without disease, but somehow we are facing few problems in everyday life, like pain and all. And diabetes also, we know it comes genetically. So my father is having diabetes, so there is a very high chance that I will also get it in some time. And also when I check my blood like every 6 months or in a year, so I'm in the borderline of, so I need to take precautions. And so I think that this book is going to be a guideline for us how to live our life, and we all try to follow Baba's words, like how to live healthy life, what to eat and what we should avoid. But still we need some specific, like prescription or something, like we need to follow every day. Sometimes we forgot what Baba said. So I think that this book is great, and I have just seen few lines in the samples, but I don't remember actually now. So I would like to buy this, and somehow we could not buy it in Amazon. In Amazon DE, it is somehow not working because we tried 3-4 times and we contacted Sharmila as well. That why it is not showing for like buying. We could not buy it. And today also I was trying when I joined this call. My husband he tried also to buy it, but somehow it didn't work. So we will try it in some time. And I wish you all the best, and I think I will also get great help from this book. Thank you.
Thank you so much, Arunima. That's really nice of you to give such a good feedback. We move on to Dr. Kakoti, Dr. Ankuran Kakoti. So how do you feel the book is ranking so well, number 1, number 2, number 3 worldwide? What are your feelings?
So it's like a very, very difficult thing to digest, like how well this book has been doing. The feedbacks has been amazing. I have been getting text messages and I've been getting calls from my friends and some of my patients as well through a variety of ways. They're saying that this book has a very good way of passing the message on. It has got a very unofficial kind of a brand ambassador in a way that, we haven't kind of put up Baba as like the main picture in there. But however, when you read it, it speaks for itself, saying the oldest man is talking about diabetes. So it automatically is bringing a lot of interest from the public.
I will just read out one feedback which you had shared with me, Ankuran. I think one of your readers, they sent you the feedback on your phone.
Yes.
You shared this with me. I'm going to read this out. So the reader says, your book is the correct balance of information, advice for food, exercise, and simple lifestyle changes, but never boring nor complex. Well worth a read. Cheers. So this is one of the feedbacks. I've got one more feedback. I'm just going to read out. So this feedback came from India. So it says, thanks, very good, explained in simple language. Keep it up. I'm really moved by this book. So these are some of the feedbacks we are getting. We are yet to receive official feedback on Amazon website. So I'm requesting everybody who have completed the reading, please post one of your reviews or feedback on Amazon. I'm going to go back to our slides. So I just wanted to highlight one thing here. I think last time we could not manage to touch on what are the highlights of this book. So I'm just going to talk a little bit about the highlights, and then Shritama, if you can also chip in a bit later. So number one, the main highlights is this book is a holistic approach to treating diabetes. So even though most of our writers, authors are doctors, are medical doctors by background, we have not just focused on the medical management of diabetes. We have looked at all the different approaches for treating diabetes, like the Eastern treatment methods, like the yoga, the Ayurvedic approaches. Then we have the traditional Chinese medicine approach, and we have also focused very much on lifestyle changes and how with lifestyle changes people can actually reverse diabetes. We have focused on the vegan diet or plant-based diet. Currently, plant-based diet has been trending all over the world because it has so much health benefits. So why not take advantage of this plant-based diet in treating diabetes? There is a chapter in this book called The Future of Diabetic Care. In this chapter, it's quite a valuable chapter if somebody has type 1 diabetes, because there are a lot of new treatment models that have come up with research, and there are lots of information, and especially for those patients who are based in the UK, we have given links on how to access some of these resources. Now, this book, another highlight of this book is it is one of those few books which is available in the market now currently, which is written by a multidisciplinary team. By this, I mean, not just doctors or not just one specialty, but this book has been written by people with different background, different interests. For instance, Ruby, she mentioned last week in the first part of the book launch that she's a Hatha yoga teacher. She is a yoga practitioner. She's a certified Kathak dancer. And then also she has got, she's currently doing a course on diabetes in the West London University. And she works in the NHS in primary healthcare. So such a multi-talented person. And we also have authors, not just based in the UK, but also all the way from India. Dr. Shritama Banerjee. And so she sees diabetes day in and day out in the outpatient clinic. So it is actually, we are getting a perspective, not just from the West, we are also getting a perspective from India. So that's why this book is quite valuable. It is full of resources. And last but not the least, this book also mentions and shares some success stories. And I have collected these success stories by going into different authentic websites like Diabetes UK, diabetes.org, where real patients have posted their real success stories, which are actually going to be an inspiration for all those people all over the world who have recently been diagnosed with diabetes and who want to fight this battle against diabetes, who want to get rid of diabetes. So these are the success stories. Shritama, do you want to share anything that you think this book is, why does this book stand out? What are your views?
Um, I feel that this book stands out the most because it has been written in such an interesting language, because all the general people who are laymen, who are not doctors, they can connect to this book. And there it has a multidisciplinary approach, and it focuses on the Western medicine as well as the Eastern medicine, as well as different lifestyle changes. And all these changes can be imbibed by people in various aspects of life. At least uh, if these habits, if these lifestyle changes are imbibed in life, then diabetes will not precipitate, and it can be prevented to a large extent. And this covers an entire uh, it covers a lot of things which can lead to prevention of diabetes.
Yeah. My specialization is stress management. I'm a psychiatrist by background. And I find that lifestyle diseases are also stress related. I think one of the other highlights of this book is I have spoken a bit more in detail about how to manage stress in day-to-day life. I think there are a lot of stress management books out there, but people who buy this book, this particular book, at least they will get some idea on how to manage stress, day-to-day life stresses. There are lots of exercises in this book, a lot of reflective exercises. I think, Shritama, you have incorporated mindful eating exercises in it.
Yes.
And I think there are other exercises also in it. So a person who can buy this book actually gets not just one perspective of the problem. It gets like an all-round problem. And then the person can actually then make strategies, make plans on how they can then move forward to combat diabetes. Let's move on to Dr. Kakoti. So tell us, what do you think are the specialities of this book? Why do you think this book is standing out? And why do you think it's doing so well?
So, based on the feedbacks that I have received, and also by going through the book myself, I have felt that different approach from different patients and different readers, because some of them like certain kind of things, some of them like medicine. Not everybody wants to have medicine, but this book is being said and has been having a few different kind of approaches. So say you want to focus on the lifestyle part of it, then obviously you can try that, and any start is a good start, you see. So I feel there's a lot of different way of starting the managements, and this book is a way of going through all of this, pinpointing on the variety of the options that a person can look into it.
Thank you. I think that's really valuable. So We are just waiting for Ruby to join. She will be joining in a few minutes. I'll come back to you, Arunima. I have one question for you. You have known Swami Shivananda for a really long time, and I think he has been to your house as well in Switzerland. Tell us a little bit about what has your experience been when he came to Switzerland. I mean, how did you feel? Did you feel like overwhelmed, excited? How was the whole experience when he stayed with you?
It is, I think like when Baba comes, that is Baba's home. So we are in the shelter of Baba. So nothing is special. So we are just like, we are with our father, so fatherly atmosphere, and we are always like listening to him, and people come came here to meet Baba. So that was also wonderful time. So I am still waiting if he can come again to us. So that was only very short visit of Baba. Previously in India, we were lucky to have Baba for more than 2 days, sometimes 5 days, sometimes. Like it depends. Like when Baba had time, he came to Chandigarh as well. But in Switzerland, he promised me he will come. So we had only 2 days with him, and that passed like just a few minutes like that. Like still I remember, okay, I went Baba here and there. Like we had also planned some visits in Switzerland. So that time was very short. So when we recall it, I don't find like, okay, I spent time with Baba. Like sometimes we just have food, and then after that we have to take rest up. So everybody, like
Yes.
we lose time in that also. So we have nothing like what I can tell you, like few sayings of Baba what I can remember, because people were also, I also invited a few of my friends, and my husband also invited his colleagues to meet Baba. So that was a very busy time as well, and short time, as you know. So yeah, but I feel really excited to buy this book and read this book after hearing such nice feedback. So I think it will be very helpful for us as
Thank you
well.
so much. We've got Ruby Nair, author of this book, who has just joined. Hi, Ruby.
Hi. Hi, thank
Hi.
you for having me
Thank you
here.
for joining. Namaste. We will come to you, Ruby, in a minute. We have got another guest who has joined you, Anima. Anima, you from
Yeah.
Switzerland, right?
Yes, yes.
Hi, Anima. Welcome. So tell
Thank
us a
you.
few words. How do you feel about this book? How to Eradicate Diabetes, inspired by Swami Shivananda? Because I think you've met Swami Shivananda yourself, isn't it? I think you went to India to meet him as well.
Yes, yes, yes. Last time I went to India and I met with Baba.
Yes. So how do you feel about this book, dedicated and like inspired by Baba?
Actually, I don't know, just I saw the message.
Okay. Right. We come to Ruby now.
Okay.
Yeah, we'll come back to you, Anima, in a minute.
Okay.
So, Ruby, we were just discussing about how everybody's feeling about this book doing so well. It's top ranking. Last week, as soon as it was launched, it was number 5 in Amazon Hot New Releases. And now it's currently ranking number 1 in medicine and number 2 in personal health in India. And in the UK, I just literally checked just a few minutes ago, it was ranking number 2 in personal health and number 3 or 4 in medicine, I think. So it's doing amazingly well. How do you feel, Ruby? Congratulations, by the way.
Wow, thank you so much. I think, and thank you so much for having me on board on this wonderful team. I think we've worked so amazingly well and collaborated so fantastically together, even though we're all in different parts of the world and doing our own, various things. So I think it's amazing that we've managed to have such a great achievement in really such a short space of time. And obviously your Baba is such an inspiration, because I haven't had the privilege of meeting him, but I have read a lot about him and I've seen his videos, and I think that he's such an inspiration, and we can all learn so much from him. And this book has really been quite a journey, I'm sure, for all of us. Certainly for myself, it's been a fascinating journey and a learning experience, because you really have to put yourself in the shoes of the people who are really suffering and try to make it as accessible to everyone, so that, you know, everyone can, the lay person in the street can understand, you know, the medical terms and the nutritional kind of content that's quite, you know, content heavy. And it, you know, like I said earlier, you learn from your own work, because you have to break it down. When you know, there are sayings that when you have to teach someone else, that's when you really know your stuff, because in order to be able to teach it and coach it, you have to break it down into its basic format. So I'm sure for all of us, we've been totally inspired, not just by Ababa, but from each other. I certainly got a lot of inspiration from Dr. Shamila, and you know, it's been a wonderful journey working with you, I have to say. So kudos to everyone.
Thank you. I'm just sharing the screen here. So it's a ranking number 1 in the medicine category in India. So as you can all see, so it has achieved a lot in a very short space of time. The reason why this book is standing out, why people are finding it useful, is Ruby, I was explaining just before you have joined, is because these are the couple of points I'm just repeating, because it's a holistic approach to treating diabetes. We are focusing on plant-based diet, which is trending a lot. We are talking about the future of diabetic care. And it's one of those very few books which has been written by a multidisciplinary team, because we are all from different backgrounds and different specializations, and we are all adding our value to this book. And we have success stories as well in this book. So I think that is it really for today, for the second part of the book launch. I would congratulate again all the readers, all the writers, and request all our readers to kindly leave reviews on Amazon. Any last words? I'll give maybe a couple of few seconds to all our authors to say just a few golden words before we wind down and wind up for today. And just an announcement that we are planning to launch a sequel to this lifestyle diseases books. And the second sequel will come up early next year. So please stay posted for that. And we will be focusing on another lifestyle condition. So please stay posted. So I'll start first with Dr. Kakoti. Do you want to say last few words?
Yeah, so this has been an amazing story with a variety of different feedbacks. Most of them has been excellent and inspiring. And as you said, like the next venture, the next project, the next proposal has been amazing. That's already exciting, and we look forward to go ahead with that.
Thank you. We move on to Shritama, Dr. Shritama Banerjee. Few words, please.
My journey has been amazing, and I really feel very fortunate to be part of this amazing team spread out across the world. And it has been a learning experience for me as well. It's my first time collaborating on such a huge project. And all thanks to Baba for this. And I mean, I have learned a lot from Dr. Sinha, Dr. Sharmila Sinha. And it's been an exciting journey. And of course, I'll be more than happy to participate in the next project. And it will be my honor. And I have received a lot of amazing reviews from different people who are like old aged people, middle aged people, and youngsters too. And I have shared to all my colleagues and all my friends, and they have all been overwhelmed by the success of this book. And I'm so happy and so thankful for this. Thank you.
Thank you so much, Shritama. That's really nice, and look forward to collaborating with you next year. So we move to Ruby. Do you want to say last few words?
Yes, thank you so much. Again, Shruti Miles echoed my words completely. I feel very fortunate and very blessed to be in a group that's so nurturing of each other, so understanding. And and also a bit strict at the same time. So I know Dr. Shamila has been a bit strict with me, but we need that kind of drive and that ambition. I mean, we're all very ambitious and we've worked really hard, and I really am looking forward to the next edition of our book, the sequel to our the series, because there is so much that we can give, and this is, I think we've just touched the tip of the iceberg, so to speak. I think there's so much more depth that we can give and we can share, and I think that's really what it's about. When we share what our journey has been, then we're able to help others as well. So I'm really looking forward to it. Thank you.
Thank you, Ruby. So lastly, just I wanted to say goodbye to everybody who's been joining in our podcast on the YouTube channel. And please get yourself a copy of this book. So it is free to download today until midnight. Please don't lose this opportunity. Please download this book for free on Kindle. Anywhere you are in this world, please take this opportunity. It is ranking number 2 and number 1, as you can see under the category of medicine and personal health. So this is only possible because of the readers who are reading and recommending this book to everybody. So huge thanks to everybody who's taken an interest in this book. And until next time, until we come up with our next sequel, have a lovely time and take care.
Thank you.
Bye.
Thank you. Thank you. Bye-bye. Bye.
Bye-bye.
Bye-bye.
Bye. Namaste.
Namaste.